First at 10, a state program providing health insurance to adults without children, preparing to max out its applicants tomorrow. I'm News 3's Andy Choi. Tonight, a candidate for governor says the BadgerCare Plus program needs an overhaul that includes limits on how long people could get benefits.
I think it's got to be not just a pure time limit, but progressions for you've got this amount of time, here's what we expect you to do, here's the options you should have by that time, so that they're clearly defined expectations of how you're going to ease off of assistance from the government.
They already have no income. They're already struggling to pay their mortgage and their bills. And so if they had no health care on top of it and no real option for health care, that would just make the situation a lot worse for those people.
While the state says the program provides much needed help, Milwaukee County Executive and Republican candidate for governor Scott Walker told News 3 today he thinks BadgerCare has become an entitlement program rather than temporary assistance. The night team's Jessica Arp tells us as the deadline approaches for BadgerCare, the uninsured and unemployed are rushing to get in. Jessica.
Well, Andy, so far 3,000 people have signed up just this week, anxious to get health care before time and money runs out.
Fingers are fast and furious at Access Community Health Centers as the scramble is on to sign up for the BadgerCare Plus core plan before a waiting list begins.
I think it raises a lot of questions for people and just a lot of, rush, a feel of anticipation and just rush to get things done. And are they going to get approved? And what happens with this situation and that situation? There's just a lot of confusion and a sense of urgency that they get the application submitted on time.
Access has signed up more than 1,000 people since June and pushed up an additional 20 or 30 appointments to get them in time.
This means that people can get surgeries that they've needed for a long time and get that care that they've needed, and they can finally get it. So it means a lot to these folks.
The state says to get in by the deadline, internet is best. Expect a 30 to 40-minute hold time on the phone. And if you end up on the waiting list, they're working on a self-funded plan they hope to start soon.
We can only put the benefits in that can be afforded by that monthly premium. And that's really what we're doing right now, trying to figure out how much generic medication coverage, how much preventative doctor visits, if we can afford to put any sort of basic hospitalization coverage in it.
And the chief medical officer of Wisconsin Medicaid and BadgerCare told a health care panel today officials were working, quote, feverishly to try and get that buy-in plan set by Monday. But a Department of Health Services spokesman says a rollout next week of that is unlikely.
So, Jessica, if people discover they need coverage after tomorrow at noon, what are the next steps?
Well, they should just follow the same process to sign up at BadgerCarePlus.org. They'll be processed and put on the waiting list, so they'll qualify for that buy-in plan once it's available, and we will be let in as space allows, which could be weeks before we know how long that could be.
All right, well, we'll see what happens. Jessica, thank you very much.